Okay, I think we'll go on ahead and get started. Good afternoon, and thank you for joining us today for our webinar on HIPAA compliance and security in 2021. My name is Tricia Rogers, and I am the Program Officer for the Northern Virginia Health Foundation. For those of you who are not familiar with the foundation, our mission is to improve the health and healthcare of Northern Virginians, and we are the only health philanthropy in Northern Virginia that supports programs and initiatives throughout the Northern Virginia region. Now, I suspect that some of you participated in the webinar that we hosted in December, which was on EM billing and coding. And our expert webinar leaders were from the firm Rosen, Sapperstein, and Friedlander. I'm very pleased that we're joined again today by an expert from that firm, Denise Walsh. She is, as I said, an expert in HIPAA privacy and security requirements. And she's going to do a brief overview and then go into some detail on the expanded guidelines that were put in place on account of COVID. Before we actually get into the meat of today's session, there are a few things that I need to mention. First, this session is being recorded and it will be posted on our website along with Denise's slides. Secondly, we are going to take questions after Denise's presentation, but as she is talking and a question occurs to you, feel free to type it in the chat box. And third, there are going to be times during today's session where we're going to ask you some questions. And the first thing we're going to do, and this is so that Denise knows who is in the room, we're going to ask you to type in your name and your organization in the chat box. We'll give you a few seconds to do that. Great, Denise, it looks like we have a good representation from a variety of different practice settings in Northern Virginia.
Great. That's good to hear.
Thanks again for joining us today. Before I turn it over to Denise, I do need to mention that at the end of the webinar, we're going to ask you to complete just a couple of questions. We want your feedback about the session, so please take the time to do that for us. And with that, Denise, I'm going to turn it over to you.
Thank you, Tricia. Thank you for that introduction, and welcome to everyone. Thank you for attending today's HIPAA Privacy and Security training. I'm going to go off video right now so you can have the full screen and see our slides. So today's presentation, hold on one second here. There we go. So for today's presentation, our key objectives are, we're going to go over the basics for HIPAA privacy and security. We're going to touch on the HIPAA expanded guidelines during COVID. Discuss some of the secure platforms for your telehealth, and reviewing internet security for remote workers, and then updates that have happened for 2020 and 2021. And then go over some common violations, potential risk areas, penalties, fines, and then creating your own HIPAA compliance checklist for your practice. So, we have a lot of information to cover today, new HIPAA updates, as well as issues that are pertinent to everyone during this public health emergency. But we can't do a HIPAA training without reviewing the HIPAA basics. Whether this is your first HIPAA session or it's your 10th HIPAA session, it's always important to review the basics. But before we get started, we want to do a poll question. So many people have different feelings on HIPAA, and we want to know, what is your comfort level with HIPAA? How familiar are you with HIPAA? So don't worry, this is a no judgment zone. We just curious. So, what is your knowledge on HIPAA compliance? Completely compliant, very compliant, somewhat compliant, not very compliant, not confident at all. So if you could just answer that question for us. It's always good to see where our attendees are, where we're starting out. Give you a couple seconds here to submit your answers. Okay, so it looks like the majority of people are somewhat confident, and that seems pretty typical. 25% of you are very confident, and 13% are not confident at all or not very confident. So it's good to see that we're right there in the middle with the percentage, the largest percentage of everyone. That's good. Okay, so we'll go forward here. So let's start. What is HIPAA? So HIPAA stands for Health Insurance Portability and Accountability Act. This was put into place in 1996 by Congress. HIPAA gave the federal government the ability to maintain how covered entities maintained, stored, received, and transmitted PHI. There are three parts of HIPAA. This is the privacy, security, and transaction standards and data sets. We will not go over transaction standards and data sets for this presentation. We will just be focusing on HIPAA privacy and security. HIPAA legislation was further updated in 2009 with the HITECH Act, and then again in 2013 with the Omnibus Act. So let's go over privacy first. The purpose of HIPAA privacy is to protect patients by providing them access to their protected health information, or PHI, and the ability to control and use and disclose their PHI. It was also intended to restore public trust in the healthcare system and make it more effective and efficient. So the best way to understand HIPAA is to know the terminology. So let's move forward with that. So what is a covered entity? A covered entity is a health plan or payer that can be commercial or government. It can be a health care clearinghouse or billing services, anyone who possesses your PHI. And that includes your healthcare providers, such as physicians, hospitals, nursing homes, pharmacies. These are all considered covered entities. This gives you an example of covered entities. You can see healthcare providers, doctors, dentists, pharmacies, health plans, clearinghouses, billing services. These are all considered covered entities. PHI, or protected health information, is any information about the patient's health status. This is their medical record or payments that is created or collected by a covered entity and can be linked to a specific individual. Individually identifiable health information, or IIH, is PHI that may identify a patient. It's composed of 18 elements. This is everything about you, everything about the patient. It's the name, the address, the phone number, social security, medical record number. Those are all the things that you would assume would be your IIHI, but there are also things that you don't consider, things such as your driver's license, photographs, even your IP address is considered individually identified health information. Use and disclosure. Use is the sharing, employment, application, utilization, analysis, any use of PHI. Disclosure is the release or transfer, giving access or divulging PHI in any manner to anyone outside of your practice. An authorization. So what is an authorization? An authorization is written permission given by the patient to use or disclose PHI. A healthcare provider must obtain written authorization to use or disclose for the use or disclosure of PHI for all purposes other than TPO. The authorization should be very specific. And I always tell practices, most authorization forms are very vague. Take this opportunity to review your authorization forms. The more specific, the better. These forms are in place to not only protect the patient, but to protect the practice as well.
Denise, I just have a question. Oh, TPO.
Sure.
Okay.
There you go.
Answer it.
That's what I was going to say. So what is TPO? Thanks, Tricia. Anyway, so TPO. TPO is treatment, payment, and operations. So treatment is just that. It is the coordination or management of the patient's health care with either another provider, another entity. It is anything that is related to that patient's treatment. Payment means any activity necessary by the practice to obtain reimbursement for healthcare services. Typically, in billing, you may have to send notes for a certain claim to get that paid. You do not need the patient's authorization to release those records to the insurance because that is for payment. And then we have operations, which are the practices, this is for the practices business and clinical management. This could be teaching, training, or practice quality improvement. Minimum necessary standard. So this is very important. This is the basis for the entire privacy rule. So the minimum necessary standard requires that a covered entity limit the amount of PHI that is used or disclosed to minimum necessary to accomplish the intended purpose. So just because a patient's PHI may be available to you does not mean you have the right to access this information. You do not have the right to access your neighbor's PHI if they come into the practice. Nor do you have the right to access a celebrity who may come into your practice, their PHI, unless it is necessary for your job function. You may remember several years ago, I think it was around 2009, that there was an incident with Britney Spears. She was admitted into an LA hospital for behavioral health reasons. 13 employees were fired because they were snooping into her medical records. The Office of Civil Rights, the OCR, also assessed a very hefty fine on the hospital. So you might want to think about it twice before the next time you say to somebody, guess who came into our practice today? So remember, minimum necessary standard. So the Notice of Privacy Practices. This is a document that outlines everything that the covered entity will do to keep the patient's PHI secure. This includes the patient's rights and as well as the covered entity's responsibilities. The covered entity must provide new patients with a copy of their privacy notice, and you must obtain acknowledgement of receipt from the patient. Covered entities are also required to post a copy of their Notice of Privacy Practices in their office. This can be anywhere in their office. Typically, it's in the waiting room. Some practices post a copy in each of the exam rooms, totally up to the practice, but it needs to be posted. If the practice has a website, the Notice of Privacy Practices also needs to be posted on their website. Business associates. So business associates are persons or entities that are not a member of the practice's workforce who use or may disclose PHI to carry out certain functions. With the HITECH Act, business associate definitions have been expanded to include organizations that transmit, store, maintain, receive, or require access to PHI. There are currently now 10 times more business associates than there are covered entities. So it's very important that you have control of your business associates. Business associates must sign a business associate agreement, agreeing to abide by HIPAA privacy and security rules. I recommend that you review the list of your current business associates. Do you have business associate agreements in place for all of them? When were they last updated? Create a business associate file and log and make sure that you are tracking this and make sure you have signatures and track the signatures. So as I said, under the HIPAA omnibus rule, HIPAA privacy, security, and breach requirements extend beyond the covered entities to all business associates and downstream vendors and subcontractors that have access to PHI. So it is very important that you know your business associates. Before you sign a business associate agreement, you should vet your business associates. The vetting process is ultimately to quantify the risk of sharing PHI with a particular business associate. Although the law now puts liability on the business associate, it's still the covered entity's responsibility to confirm that the business associate is compliant with HIPAA. So determine your business associate's HIPAA awareness. Make sure that they have policies and procedures in place. Make sure that they have done a security risk analysis. Make sure that, do they have any potential security threats or vulnerabilities? Ask to see this information. Do not just take their word for it. It is the responsibility of the covered entity to conduct their own due diligence. So now let's move on to HIPAA security. So what is the difference between HIPAA privacy and HIPAA security? HIPAA privacy applies to the confidentiality of all forms of PHI, verbal, written, paper, electronic. It's a lot of do's and don'ts, and it's very template driven. And the privacy is basically the same across the board for all covered entities. Security applies to electronic protected health information, or EPHI only. It includes created, received, stored, maintained, or transmitted EPHI. This is all about reasonable and appropriate due diligence in keeping the electronic PHI secure. There is not one standard security template for all covered entities. Each entity has their own risk. Even different practices or different practice locations under your umbrella may have different security concerns or security risks. In fact, statistics show that larger entities are at greater risk, but smaller entities are the ones who struggle to comply with HIPAA security. So everyone should have a HIPAA security plan and know the goals of a HIPAA security plan. So a HIPAA security plan really is based to ensure confidentiality, integrity, and availability of the electronic PHI. Additional security plan goals are to protect against any reasonable or anticipated threats or hazards to the security or integrity of the EPHI. You want to protect against any reasonable or anticipated use or disclosure of information, and you also need to make sure that your workforce is compliant and trained. So that's the basis of a HIPAA security plan. So when you create your HIPAA security plan, you must address the three different safeguards: administrative safeguards, physical safeguards, and technical safeguards. So your administrative safeguards are basically your policies and procedures. This makes up over 50% of your HIPAA security plan. The physical safeguards are controls and measurements you put into place to prevent unauthorized access to the facility or your workstations. And your technical safeguards, this all has to do with your information technology, your configurations, those kinds of things. These are access controls, your firewalls, your VPNs, your encryption. These are, again, the basis of your security plan. So another important aspect of HIPAA security is a breach. And first you need to know what the definition of a breach is. A breach definition is unauthorized acquisition, access, use, or disclosure of unsecured PHI is presumed to be a breach unless it is demonstrated that there is a low probability that the PHI has been compromised. So they say unsecured PHI. It is not considered a breach if the information that has been breached or that has been accessed is encrypted. So keep that in mind. Make sure that you have things in place, encryption at rest, all of those kinds of things, because if the breach will occur if the information is unsecure. If it's secured information, encrypted information, it is not considered a breach. Your HIPAA security plan should include a breach assessment procedure and notification process. So let's discuss your HIPAA risk assessment. So the best practice is to review your HIPAA regulations regularly and update your HIPAA plan on an annual basis. This is doing your security risk assessment yearly. The risk assessment, honestly, again, it is the basis of your security plan. What you find in your risk assessment should drive your policies and procedures. You can't just create your plan and let it sit on the shelves without reviewing it. It needs to be updated, and it needs to be done so regularly. You want to make sure that if you're doing at least an annual assessment, that that should at least protect you in some respects in case of a possible audit. And the OCR will do audits. They are random audits. They are occurring more and more often. Audits can be desktop, which are a written requisition sent to your practice requesting all of your written policies and procedures. Or they can also do an on-site audit, and that is just what it says. They come on site, they will review all of your policies and procedures on site, but they also want to see, observe what security measures you have in place. All covered entities are subject to either types of these audits, so you want to make sure that you are prepared. So how do you prepare? You do your security risk assessment. So again, the security risk assessment is the catalyst for your HIPAA security plan. The risk assessment focuses on evaluating and prioritizing security risk. Risk activity should be prioritized based on the likelihood of occurrence of the security breach and the likeliness of such severity of such breach. Your risk assessment should again include policies and procedures, system audits, and your staff training. When you come to system audits, you want to make sure that your EMR system, and if it is a certified EMR, which most everyone has now, it has a functioning audit system. You need to make sure that that functionality is turned on and that you review your system audits. At the end of this presentation, there are several links. I have several links that you can use as resource tools to help you with your security risk assessment. I recommend having an IT professional help you through this process if you are unfamiliar with it or you are not technically savvy. Most IT firms that deal in healthcare are very helpful and will, really help you through this process. So let's discuss the expanded HIPAA guidelines during this COVID-19 public health emergency. So 2020 was a very interesting year, to say the least, and hopefully 2021 will be a better year for all of us. The COVID-19 public health emergency has changed the way many practices do business. And as a response to the public health emergency, HHS has temporarily expanded HIPAA guidelines. So CMS broadened access to Medicare telehealth services to help mitigate travel and access to physician and physician practices. Medicare, along with most commercial insurances plans, have extended their telehealth guidelines during this public health emergency. We will have to wait and see what the current administration does regarding the public health emergency, if they are going to extend the public health emergency, and how these expanded guidelines will be affected going forward. So currently, we are under the telehealth expanded guidelines, and this allows for telehealth services to be furnished to a patient in all areas of the country in all settings. This includes providers in any healthcare facility or in the patient's home. These visits are considered the same as in-person visits and are paid at the same rates. So what types of visits are considered telehealth? We have audio and video encounters, telephone services, virtual check-ins, virtual consults, e-visits, remote monitoring, and store and forward images and videos. So coverage for these services are payer specific. So as always, check your payer guidelines to make sure that they are covering these services, but these are considered telehealth services. So as I said, during COVID-19 emergency, the Office of Civil Rights, the OCR, has allowed additional technologies to be used for telehealth without imposing penalties for non-compliance. Under the emergency notice, covered health providers may use popular applications for video chats. This includes Apple FaceTime, Facebook Messenger, Google Hangouts, or Skype to provide telehealth. Normally, Skype and Apple FaceTime are not secure, which means they are not HIPAA compliant. Public-facing applications such as Facebook Live, Twitch, TikTok, these are, even during this public emergency, these are not allowed for telehealth services. The OCR does recommend that providers prepare to use HIPAA compliant vendors following the COVID-19 public health emergency. So we have been in this public health emergency now for almost 10 months, 10 plus months. So if you are doing telehealth services at this point, you should be looking, and we're using non-compliant methods or platforms. At this point, you really should be looking into more HIPAA secure platforms to use for telehealth. You should look for additional companies that have additional privacy protection and should consider using vendors that are HIPAA compliant and offer a BAA. So here are some of the compliant vendors that are OCR compliant. Not that we are recommending any of these vendors. We are not endorsing any of these platforms. These are just examples of some to use if you do not have HIPAA compliant telemedicine platforms already. So I'd like to go over some tips for telehealth. It's really important to notify your patients that you're using a third-party application and that you are potentially introducing risk to the patient. So the patient must give consent to be treated virtually, and the consent must be documented in the medical record before initiating the services. If you do not have a telehealth written consent form, I would recommend creating that one now. If you don't have written consent, verbal consent is necessary. But again, I would, at this point, telehealth is something that is here to stay. It is going to be the new norm. So, I would recommend that your practice create a telehealth authorization form, put it in with your patient registration packet, make sure that you've got patient consent and acknowledgement that, and this consent and acknowledgement should be for any type of non-compliant communication as well. This would go with emails and texting as well. So let's talk about now working remotely. This again is the new norm. Where are you actually watching this webinar from right now? There's a good chance that some of you may be sitting at home with your laptop, watching. And it's also likely that during this public health emergency, you or maybe some of your coworkers worked from home on a regular basis. Telecommuting or remote working has become very popular even prior to the COVID-19 epidemic. Remote working can reduce overhead costs, minimize employee burnout from traveling and commuting, and possibly increase efficiency and effectiveness. But how do we make sure that this is secure? So recently, IT professionals were surveyed regarding their experiences with remote workers. Here are the results. So first they were asked, what percentage of remote workers do not work securely? Their answer was 90%. What percentage of organizations have been hacked as a result of remote workers? IT professionals said 36% of remote workers. And what percentage of employees use the same password over and over? Again, 25%. So hopefully seeing these statistics will help you start to think about good security practices for working at home. So how do you keep your data secure for remote workers? Well, with strategic planning, you can create a remote working environment that supports the organization while maintaining the security of your system and data. There are steps that both the employer and the employee must take to have a secure working environment. In October, the FBI declared a warning of imminent and increased cyber threat to U.S. hospitals and healthcare providers. Cyber criminals are taking advantage of this public health emergency, and they are attacking us where we're vulnerable. So before we move on, it's time for another one of our polls. So this time we want to ask you about the security of the data working at home. How confident are you that your data is secure working remotely? Are you completely confident, very confident, somewhat confident, not very confident, or not confident at all? So if you could just answer that for us, we'd appreciate it. Select your answer and submit. We'll give everybody a couple seconds here. We'll wait for those results to come in. So, this is very good. This is good to see. So 30% of you are completely confident, 40% are very confident. That's good. That's good to hear. 10% confident and 20% not very confident. I'm glad to see that there is no one thinks that they're not confident at all. So this is good results. These are good. So, well, let's move forward and discuss what we need to do. So, as I said, many cyber criminals are taking advantage of this COVID crisis to infect practices and hospital networks with the hope of stealing or holding medical record information for ransom. Think of your home office as a miniature version of your practice. You, as the employee, have responsibilities to secure data. So it's very important to secure your workspace. You are a target. Secure important work-related items. Enable security settings on your router. Use wired connections instead of wireless. Use unique passwords and change the default passwords always. Make sure that you activate firewalls. Install latest security updates. Shred documents. Adopt a clean desk policy. And really, very, very importantly, do not mix work and personal use on your devices. Watch for common threats. These are phishing emails, ransomware. Think of all of this as maintaining a good cyber hygiene. So there are employer responsibilities as well. So first, as the employer, you need to determine who needs to be working remotely. Is this the entire user base or just a select group of employees? What data is being accessed remotely? Are they accessing internal network resources, cloud-based applications, or internal and client data? How is data being accessed? Are they accessing internal resources via a VPN or cloud-based? Are workers using personal devices or are they using company devices? As the employer, you really should have defined policies and procedures on all of this. Create policies and procedures regarding passwords, your malware, encryption. Create restrictions regarding data storages. Many companies have automated backups in place with their devices, but if the employee is using personal device for work purposes, how is that information being backed up? So this really does give us a lot to think about. Employers should also configure controls to support policies regarding data that can be accessed. Again, many remote workers use access and cloud-based applications. So you want to make sure that the employers centralize and enforce these controls. Lastly, employers should train their staff. All employees need to be aware of the risks associated with remote working. Talk to your employees about current threats, the risk of using public Wi-Fi, and the heightened threat of malware when using computers for both business and personal use. So, besides the expanded HIPAA regulations due to the public health emergency, there have been several additional HIPAA updates for 2020 and 2021. So we're going to kind of touch on a few of those. So one of the first things, the medical record retention law has increased. It has gone from 6 years to 10 years. The Supreme Court ruled that this should correspond with the Federal False Claims Act guidelines. So please check with your state guidelines, because when it comes to medical record retention, state guidelines overrule. So check with your state guidelines because it may differ. The OCR, another good thing to know is, for an update, the OCR has released an updated version of its security risk tool. This is version 3.0, and it helps covered entities comply with the risk analysis provisions in the security rule. So here's a link to that new assessment tool. Again, as at the end of the presentation, we have additional links that will help with your security assessment. But again, this is a good tool for you, and it's a nice update that is provided by the OCR. Additional updates, the OCR made an inflation adjustment to civil monetary penalties. So these penalties have been increased by a factor of 1.3. These fees are determined by the level of culpability. So it goes from no knowledge to the level of willful neglect. And that can be, depending upon your neglect and your response to whatever your penalty was. There is a cap on fees that can be charged by covered entities for copying medical records to third parties. Again, this is something that may vary by state, so check with your state guidelines to make sure what those changes have been. This is something that is really important. Information blocking is really a hot topic these days. Information blocking is a practice by either a health IT developer, health information network, health information exchange, or a healthcare provider that, except as required by law or specified by the Secretary of HHS as reasonable and necessary activity, is likely to interfere with access, exchange, or use of electronic health information. The bottom line here is this is patients' right of access. In March 2019, the Office of National Coordinator of Health Information, that is the ONC, issued a proposed rule. It's the 21st Century Cures Act. Improperability, information blocking, and the ONC Health IT Certification Program. That's a mouthful. And it released its final rule in May of 2020. But due to COVID, the ONC is extending compliance dates and timelines. But this is really, again, this is really a hot topic, so I really wanted to touch on this. So what is the Cures Act and how does it affect your practice? So the Cures Act is designed to give patients and healthcare providers secure access to health information. It also aims to increase innovation and competition by fostering an ecosystem of new applications to provide patients with choices in their healthcare. So simply, this law looks to increase interoperability, access, and security of PHI. The rule will allow patients digital access to their PHI provided by their healthcare practitioner at no cost. As with anything, there are exceptions to this rule. I recommend everyone do their own little research here on the Cures Act as it will, and how it will affect your practice. This is very involved, and we could probably do, a whole session, training session on the Cures Act, and it's still kind of in a implementation stage, but I really want to make sure that everyone is aware. Like I said, unfortunately, we don't have time during this presentation to do a deep dive, but I wanted to make sure that you understand what the patient right of access issues are, because this really is a hot topic for the OCR. And as I said before, at the end of the presentation, I'll have a lot of resources for you. And one of the links that I highly recommend for you, it's called healthit.gov. I think that at least somebody in your practice should register with healthit.gov for their regular updates. It has a wealth of information, and it is really right now the primary source for this Cures Act for information. So I do recommend that you sign up for their newsletters. So let's discuss potential areas of risk and common HIPAA violations. So there are 5 areas or the most common areas of deficiency and non-compliance. So are you at risk in any of these areas? The most common areas are the PHI on exposed servers, unencrypted laptops. Unencrypted laptops is one of the biggest issues out there. Stolen, lost laptops without encryption is one of the reasons for some of the most heftiest fines from the OCR. Unchanged default passwords, outdated security software, and inadequate training. So HIPAA security awareness is crucial to your practice. There are so many threats out there. Be aware of social engineering. These are phishing emails, ransomware, hackers, human error, as well as issues with mobile device security. It is extremely difficult to stay on top of all of the cyber threats, because as we become more educated, these cyber criminals become more educated. So it is very important to stay compliant. So phishing is one of the biggest cyber crimes out there right now. So phishing is a fraudulent attempt that is made to obtain sensitive information by disguising oneself as a trustworthy entity, usually in an email. So beware of these emails. This is an example of what you might see. You can see here on these emails that if you look at who the sender, there are spelling errors. They usually ask you to click on some type of link, and there is usually some urgency related to these emails. So, be aware, make sure that you do not click on anything and report any suspected phishing emails to your IT. Ransomware. Ransomware is a type of malicious software designed to block access to a computer system until a sum of money is paid. This is giving you an example of what a ransomware email may look like. This is now the #1 type of data breach in the world. And the OCR is considering ransomware attacks data breaches. Even though the information may not be accessed, it is or breached where they can see that information. They still are holding that information, and that information is no longer accessible by the practice. So it is considered a breach. Another one of the biggest issues right now is Windows 7. So hopefully no one is still using Windows 7. Windows 7 is no longer supported. And, if you are participating in any of the MIPS programs or any of the incentive programs like that, it is required that you do your security risk assessment on a regular basis. And it's also a requirement as part of your risk assessment that you have supported operating systems. So if you are using Windows 7, it is no longer supported, you are not compliant. So make sure that if you are using Windows 7, it has been updated. So let's talk about breach penalties and fines. So in 2019, healthcare data breaches were reported at a rate of 1.4 per day. Fines have increased every year since 2013. The OCR received over $4 million in fines in 2012, it doubled, oh, well, not doubled, excuse me. In 2013, it went to $6.5 million in fine, and then doubled every year thereafter, 14, 15, 17, 18, and 19. So the OCR supports its department by the penalties and fines that it imposes on covered entities. In 2009, HIPAA was amended by the HITECH Act, and the HITECH Act requires the Secretary of Health and Human Services to post on its website the list of breaches of unsecure PHI affecting 500 or more individuals. This website is known as the OCR portal, and it is also known with the unwelcome nickname of the Wall of Shame. So anyone can go to the website, to the Wall of Shame, and see these covered entities who have had breaches of over 500, affecting over 500 or more PHI patients.
Denise?
Yes.
We already have some questions in the chat box, and I know you have more information you want to cover, but I want to be mindful that some people might be on their lunch hour and would have to ring off sooner rather than later.
Okay. Let me do these last couple slides because I think that we can get through these fairly quickly, and then we'll go to the questions. So maybe 2 more minutes here. So as I said before, the OCR applies fines depending upon the level of the offense. We have tiers 1 through 4. Tier 1 is considered that simply unwilling or no knowledge, and then tiers 2, 3, and 4 are levels of willful neglect. Want to just quickly go over the most common violations. 6 out of 10 are because the security risk assessment wasn't done, or it was failed to comply with the findings of the security risk assessment. So it's not only important to do your security risk assessment. Once you find your levels of vulnerability, you must identify them and you must act on them. You know, not doing anything will put you in possible violation. Another thing here again, the right of access. 2 out of 10 enforcements in 2019 were right of access. So this is not giving patients their requested medical records. So this is very important. I want to make sure that everyone is aware of this. Again, hot topic issue. As we go through fines, you know, two separate fines for right of access. $85,000 to a hospital for not giving fetal monitoring records, another $85,000 for not providing radiology films. So these can be hefty fines. Want to just touch on this. This is a reminder that social media is never a good thing when it comes to healthcare and PHI. A Dallas dental provider was fined $10,000 for responding to someone on Yelp. Apparently they'd given him a bad review, and the dentist responded to that review and included the patient's name, which is considered their PHI. And so, you know, they were fined $10,000. So this just reminds us that providers, social media can be dangerous, and that the OCR is watching all types of providers and all sizes. So again, here's some more enforcements. Just want to go over this. $2.15 million to Jackson Health Systems because they've had several issues and disclosures over the years. Touchstone Medical Imaging, $3 million in fines. And this is again, because they're not controlling access to the PHI. So huge penalties that are enforced. So Tricia, do you think we should do the last poll question, or do you think that we should move on to questions?
Denise, I think you can do it quickly.
Okay, that sounds good. So as you can see, HIPAA violations are expensive, and you know we need to make sure that we are staying compliant. So it's time for our last poll question, and I'm just going to ask everyone, how familiar are you with a HIPAA compliance checklist? Yes, I am a power user. Yes, but only a little bit. I've only seen others use it, and I've never used or seen the checklist before. So why don't see if you can answer just to get a good idea of everyone's HIPAA security compliance level. Again, no judgment, just trying to get a good idea of where everybody stands. Give everybody a couple seconds here to answer the questions. Just waiting for our results. Okay, so it says, yes, I am a power user. Great, that's good to see. I like to hear that. So 50% of you, yes, but only a little, and 25% have never seen one before. Okay, well, that's good. That brings us to our next slide. What is our HIPAA compliance checklist? Okay, there we go. So have you conducted the following 6 required in your annual audit and assessment? So that would be your HIPAA security assessment, privacy assessment, high-tech subtitle D audit, security standards, asset and device audits, physical site audits. Have you identified all gaps and uncovered in the audits above? Have you created remediation plans to address deficiencies found in the 6 audits? Have all staff members undergone annual HIPAA training? This is so important. You know, it's one thing to have your policies and procedures, but staff need to be aware of everything and know these policies and procedures too. Do you have policies and procedures relevant to annual HIPAA privacy, security, and breach notification rules? These are all very important. Have you identified all of your vendors and business associates? Are you tracking them? Are you vetting them? Do you have a defined process for incidents and breaches? This should be part of your security plan. So don't panic. This was a lot of information. You know, we always recommend just be proactive. You know, breaches will happen, things do happen, but you know, it's what we do about them. It's how we respond to these things. And you know, are we being proactive? So we want to make sure, again, we are putting everything into place that we can. As I had mentioned several times during this presentation, here are a list of resources that I think for both privacy and security that are very good resource tools for you. And again, you know, if you have any questions, we are always here to answer, to help. Always, you know, there are sites, the HIPAA, the OIG, go to your privacy and security officers if you have any questions, you know. So with that, again, there was a lot of information. If anybody has any questions, you can either put them in the chat or you can raise your hands now. And, you know, we don't have a large group, so we could do it either way.
Denise, we do have a couple of questions already in the chat box. So why don't we do those first?
Sure.
The first question is, if an individual does not identify any person or entity who can access their PHI, can the release be authorized by a court order?
So that's interesting. So yes, I'm assuming that the court order would have to state who the information is being released to. And you do have to release PHI without the patient's authorization for a court order. So yes.
The second question, is it acceptable to share a list of employees who have an appointment to get a COVID vaccine to the employer without the employee's consent?
No, it is not. So whether the employee is getting vaccinated, it is part of their health, you know, it's healthcare treatment. So no, they cannot share with their employer unless it is given consent by the employee. That cannot be shared, and it cannot be shared if a employee ends up being COVID positive. The employer cannot divulge that information to employees. They can say a certain staff member has tested positive, but you really cannot divulge. Now, I know that's kind of difficult in small practices. Somebody doesn't come to work, you're going to know who that is. But you know, you really can't divulge that information because it is considered PHI.
Denise, we did have a more general question. Are there any other COVID-related issues that you'd like to touch on?
As for COVID, so I mean, right now, the biggest things that we're seeing with COVID, and I can put my video back on here. There we go. The biggest issues are, again, I think what we've already talked about, making sure that even though they have expanded guidelines for these telehealth services, that, you know, you are now looking towards making sure that you are using compliant methods. The OIG and the OCR will not impose fines for possible, you know, interruption or of data, but we want to make sure that at this point you are looking at other platforms that are secure. You know, the only other thing that I can say, you know, I think we touched on a lot of things that are COVID related here. And again, one of the biggest things is whether you're working from home or you are in your practice, that, you know, we are really at a high vulnerability point right now across the country. And all of our access is up for grabs because of these huge cyber threats. And so we want to make sure that, you know, you are working with your IT to make sure that your data is secure as possible. So whether you are, you know, working in your office or you are working remotely, you know, everything is put in, you know, you are putting as much things into place as possible to secure that data.
We are 1 year almost, sadly, into the pandemic, but is the OCR giving providers any slack who are just getting telehealth savvy?
So it's interesting because, you know, we are in a new administration, so we have to wait to see what this administration is going to do and if the public health emergency is going to be extended. As long as we are in a public health emergency, the OCR will be lenient. So they are letting you, you know, do that. And we have worked with a lot of practices who up until this point did not use telemedicine. We have helped them get, you know, up and running with telehealth, and, you know, helping them to decide what platform to use and making sure that, you know, they are compliant, that their documentation is compliant. So, you know, it is a process, and we do know that there are a lot of providers that prior to this really did not use telehealth. So yes, I think that, you know, as long as we are in that public health emergency, that yes, they will be lenient, and yes, the guidelines have been relaxed. You know, it's hard to say what will happen, you know, going forward. It's everybody's guess. I'm assuming that it will stay the same, but, you know, you never know.
Does anybody else have any questions that they either want to type in the chat box, or you can raise your hand? We're a small enough group that this could be a little more informal.
Yeah. While we're waiting for other questions, I just want to stress to everyone that, you know, hopefully you have your policies and procedures in place, that if you don't, you know, the resources that we have for you are really good and will help you to determine the policies and procedures needed for your HIPAA privacy and security plan. I really recommend that if you haven't done a security risk assessment, that you reach out to IT vendors to help you with that. You know, we are January, so everyone should have completed their 2020 security risk assessment. If not, you know, I would start, you know, working on, you know, doing some type of mitigation plan. But yeah, so hopefully, again, you know, this is not a one and done kind of thing. HIPAA security, HIPAA privacy, it's a continuing thing, and it goes on, you know, not only throughout the year, but, you know, constant. You're on mute, Tricia.
Can you hear me now?
Yep.
Okay. Well, if there are no other questions, Denise, I want to thank you for that very, very informative presentation, and to remind all of the participants that this has been recorded and we are going to email you the slide deck. This will all be put on our website. And please fill out the evaluation that's going to pop up on your screen as you exit this meeting. And with that, everyone, thank you. Stay well and be safe.
Thank you. Thank you for attending today.